Great, thank you. All right, just wrapping up, we had a great question during the break from the last section on kind of coming back to that issue of with limited time, but knowing that preference assessments are important, how do you decide where to start? And so the model that I showed you started with an MSWO at the top, and even if you are a practitioner who's in a classroom 1 hour a day, and you are just really there to observe the teachers and to maybe do a very specific teaching session yourself or work on a particular skill, and you're not going to be back for 24 hours, and you've got 1 hour to use, I would still take 5 minutes of that hour or 10 minutes of that hour at least a couple of days a week to get a full-scale preference assessment conducted. And I would start with an MSWO. 3 arrays, not 5. That'll allow you to validate the hierarchy of preferences within the assessment. And then the top 3 items, so if you assess 6 or 8 items, the top 3, I would have those available for a pre-teaching choice, just one trial, every block of trials or, teaching session that you do thereafter. But I would definitely dedicate, that 10 minutes. If not every day in your week, at least every other day, at least once a week. It's going to make the quality of the instruction that happens in the remaining time so much more effective if you will actually dedicate that time to preference assessment. And it's apropos because the next section we're going to talk about disseminating these methods further. That's one of the limitations we identified in the survey results, that this is a pretty portable technology. It's pretty low risk. It's pretty quick and easy. A lot of people could be using it, and yet we're not. So if you're in that classroom 1 hour per week, like only 1 day per week, or even just an hour every day, maybe there's somebody you could identify who would be the appropriate person to help get these preference assessment data, so that when you come in, you can focus your time on higher risk or more specialized activities. But you need the data, one way or another. And if it's got to be you that does it, it's worth the 5 to 10 minutes it'll take every day or every couple of days to really ensure you're working with the most potent reinforcers. One last plus of doing these full-scale preference assessments, and I will get a bit more into this, but it's important to expose our clients to a wider range of edibles or leisure items or activities to actually introduce those into the stimulus pool. So even though you may have a set that teachers and caregivers have endorsed, figure out what the most preferred are, and then find related items. Okay, so if a person has a strong preference for Thomas the Tank Engine, the next diagnostic criterion in the DSM-5, right? But so maybe there are some new Thomas toys in the classroom that you could rotate into the assessment array, and you're going to want to do that in your full-scale MSWO, for example, not in your pre-teaching choice, because it's unlikely that item will be selected, but across multiple presentations and multiple samples, you may actually establish a new reinforcer that has some similarities to other preferred items. So that's another good reason to do these full-scale assessments and to shake up the pool of stimuli you're assessing. We've got to do that regularly if we're going to expose clients to a wider range of interests. And if you're interested in this topic, that Stocko and colleagues paper is excellent as a starting point for how we as teachers might actually contribute to the restricted interests of our students by only offering them those things that they've selected frequently in the past. So it's a real key issue. Doing regular full-scale assessments can help. Okay, let's get into matching different preference assessment methodologies to settings and teacher needs. So this is where we're going to talk about dissemination to a variety of potential assessors. But first, let's talk about activities. So even when student-related barriers are addressed, we still might not conduct preference assessments as often as we should, and we still might not do it on the full range of items that we should. So it could be based on space or low awareness of the activity-based reinforcers that are available to our clients. It also could be just due to limited time and expertise around how to assess activities rather than tabletop items, things that will actually fit into an assessment array. So I promised these data earlier, again from the Graf and Karsten survey, and what you see here is that the most frequently assessed, or the most frequently used reinforcer, we just asked people to select all that apply, is actually attention, okay? So social praise and breaks from work was next most popular, along with tokens and points. Okay, and again, this is across special educators and behavior analysts. About a third of the contributors were board certified. Edibles is down here, still pretty popular among the tangible items, but it is less popular than tokens, breaks, and praise. And then we look way down here, we start to get into physical activities and community outings, rarely assessed or offered as, motivation for the hard work that our clients are doing. So we want to find ways to assess some of those lesser appreciated, but oftentimes more developmentally appropriate and more enriching reinforcer options. So application question number 9 to get you thinking. In your setting, and if you're consulting across multiple settings, pick one where you feel like the students need a greater variety of reinforcers, or we need better information about what the students are actually motivated by, what their individual preferences are. So pick one site if you're across sites. If you're in a primary site, just focus on that. What activities are available to your clients in that site? And when I say activities, I mean not necessarily just tabletop type things, activities that could involve some movement, so taking a walk, jumping on a trampoline, things that would not easily fit into a small space or on a tabletop. Could be social activities too. Okay, now I want you to think about a specific client in that setting, and maybe somebody for whom you know that we don't yet have good data on their activity preferences, and think about a couple of the available activities from your more general list that might be relevant for them. So they have the prerequisite skills, it's just something you're not sure about, whether they've experienced it or whether it could be a potential source of motivation. Okay, great. We're going to come back to this, as you might have guessed. So how do we assess activity preferences? Well, someone made the astute observation last section that picture and verbal variations can be very effective. There's also some recent research on video-based preference assessments where a person gets to see sort of a live action sample of the activities that happen in a potentially preferred location, and those data are interesting but still emerging. So there are lots of ways we can assess things that don't fit onto a tabletop. We have research history around vocational and academic tasks, identifying client preferences among those, mostly adults in residential facilities, social interactions, and finally therapeutic contexts. And I'm going to come back to this one because I think it's a really important next step for ourselves as practitioners. And then finally, community-based activities. And that's where the computer-based preference assessments are very interesting because they sort of may help to mediate that necessary delay. So if you pick between McDonald's and Arby's, we can't get to McDonald's and Arby's right away, but through the use of more salient stimuli to choose between and sort of mediating that delay to reinforce it, we might be able to get valid preferences over time, even on those delayed activities. But that's sort of an emerging area. Okay, so there are some pros and cons of picture and verbal preference assessments. And here again, I'm focusing on assessments of activity-based reinforcers. Sometimes, one of the strengths obviously is that you don't have to be able to fit it into a room, but you do need to be able to get to it in a contingent fashion, so relatively quickly. Potential problems is that there can be questionable validity if we're not providing contingent access. And Hanley, Iwata, and Lindbergh have a great paper on activity-based preferences for adults with developmental disabilities and the difference between contingent access and no access trials. And you get your valid preference hierarchies and reliability when you actually deliver the item that was selected right after it's selected. That's the best way to do it. Verbal SBAs have some of the same susceptibilities, except a lot of folks with developmental disabilities are even more vulnerable to that sort of primacy and recency effect. So if I say, do you want McDonald's or Arby's, they're going to repeat the last thing I said, right? And if I do another trial and I say, do you want Arby's or McDonald's, they're going to repeat the last thing I said. And that is a really tough powerful source of stimulus control. Is a tough sort of bias to get over and teach through. And so that's where having some pictorial stimuli might actually help to sort of obviate the need to teach through that kind of a bias. Okay, so some key steps for picture-based MSWO. This is the first method we're going to explore. It's the MSWO like you saw before, but the difference is the activities don't fit in one room, or the activities are not something you want in your teaching environment because they're too distracting or too disruptive to other students. So one of the items we use in this is actually a video on a computer. Sometimes you don't want your high-tech equipment like right there if you're working in a small place with lots of clients where anybody could get to it and knock it off the table. Or you might evoke problem behavior by having the actual item present in the teaching context. So we're going to put it someplace else. And we're going to actually choose between the pictures, but then deliver contingent access to the selected item. So it's important still that the activities are equidistant. You don't want to have to walk, a block down the hall for one and then right across the hall for the other. You need a couple of locations that are equidistant. You want still to prompt orientation to the different pictures before a selection is made. You might even think about, if this is a relatively new method of assessment for the participant, you might want to do what's called a forced choice trial. So you present the pictures one at a time and have the person exchange them or point to them and then immediately access a small sample of the activity associated with that picture. That might be a nice way to make sure they've oriented to the full range of options before they make a choice. Okay, obviously we block selection attempts before scanning is prompted. When you pick your stimuli, when you pick your pictures, you want to make sure you're using things that have pretty salient differences, especially if this is not a client who uses a picture-based system of communication or has ever done that kind of discrimination learning. There's, at least in practical terms, there is some good evidence in clinics where I've consulted and observed that using PEX icons that are associated with discriminated mans can be pretty effective in picture-based preference assessments because the person has a history of exchanging that card for that particular activity. So if a person has a history of discriminated mans for Arby's, using that PEX icon may be one way to get valid preferences even though the consequence is delayed. But if you don't have a picture-based system of communication, just make sure your cards are readily discriminable. So you're going to place them far enough apart on the table that it's clear there are, 3 or 6 and not just a pile. And you might do, sort of uncluttered but very distinctive images for each one. And you'll see that in the video. Okay, next step is to say pick one. And as soon as the selection is made, you want to either say the name of the item or provide allow the participant to sort of pick up the card. Again, this is going to be kind of a mediating stimulus and that few second delay till we can get to the activity, and then contingently and immediately guide them to the activity that's been selected. We want to make sure the access period is still consistent across options because we don't want them choosing the longest one or the highest magnitude one. We want them choosing the highest preference one that we can deliver as a reinforcer. Okay, then if you're going to do this MSWO style, you want to learn about multiple reinforcing activities. You're going to come back and repeat the choice, but without the selected item from the first trial. I'm going to actually show you trial 1 and trial 2 of a picture-based MSWO. Okay, if you want comprehensive results, so this is the one assessment shot you've got for the next couple of days, even though you can provide some quick and informal choices before teaching sessions, then you want to repeat this a few times with the full array to make sure that the selection hierarchy in each array is reliable. Okay, find out what's most preferred overall. Okay.
All right, look, there's bowling and Thomas and the tunnel. Pick one. Oh, bowling, cool. Come on, let's go. Whoa, where is it?
That was a small teaching room, not enough room for throwing stuff.
Look. Whoa, nice throw. Here.
And he's checking out the picture like, did I get what I asked for? I sure did. He's checking out our integrity. Okay, and then trial 2, this is an MSWO, so we're back to the selection, but now bowling is not an option. We're going to see what he prefers next. And we would repeat this whole process, including offering the unselected item, do you want to play with this? On the last trial, we would repeat that 3 times for a comprehensive MSWO. Okay, there.
All right, check it out, look, pick one. Oh, cool, Thomas. All right, let's go for
Notice Thomas and the tunnel switch sides.
Let's go this
okay.
way.
So Thomas was on the left, now he's on the right.
This way. Right in this room. Where is he? Oh my gosh, he's right here on the computer. Check it out.
You can see again, Michael is non-differentially high levels of praise. As long as they're non-differential, it's okay.
Are you dancing?
Yay. All right. So you guys get the idea. The method is the same. The difference is we don't have the activities immediately present, but we're still providing them contingently, and that's really the key. We have other options for assessing activity preferences. We can do a free operant preference assessment, which hopefully should still be coming up. Or we can do closely related methods, such as a concurrent chain assessment. It's a fancy name for a really straightforward and simple procedure. And this is the procedure that has been used in the literature to assess not just activity preferences, but teaching context preferences. So actually asking people with developmental disabilities, which of these procedures do you prefer to experience as we treat your behavior? And it's been done in the context of problem behavior treatment, and that's where they actually found that FCT with a punishment component was preferred over FCT alone, which is a counterintuitive finding, but again, those are powerful data that could be used to advocate for a procedure that's not typically endorsed, but that might be more effective and more preferred for certain clients. So we don't assume, we ask. So I'll go into some examples of concurrent chain, but again, we've assessed different activities, vocational tasks, and treatment contexts with these methods. So if you're going to do a free opera in SPA, you've seen the method before. Basically involves making the activities available and measuring the duration of engagement with each option. And you can do as many as you have the space to accommodate on this one. So this is when you've got a larger room, can be the therapy room or a different setting where you can arrange multiple activities. This can also be carried out for groups. I mentioned earlier some of the recent work with preschoolers on their activity preferences, and a sampling method that can be used to figure out which centers in a group are preferred by the majority of students, and then base subsequent teaching activities on those preferences. It's a pretty cool methodology. If you're interested, the references are here. Okay, some potential problems. You guys know exclusive responding can occur. So participants may spend, clients may spend an extended period with just one activity before switching, or they may never switch. You may only learn about one activity they like, in which case you can do a response restriction trial, right? Remove one activity and see if they choose to engage with no other options in the second activity. And in that case, you might actually have more than one effective reinforcer. Okay, you could also do a single stimulus variation. Provide access to just one activity at a time and measure the duration of engagement per activity, and then compare the percentage engagement. You're going to see we have reliability that bowling is pretty preferred in this clip across the various methods.
Let's go play. Whoa.
I'm hoping he grows out of that run before he needs to get a girlfriend. It's adorable, but it's nerdy. So downsides, downsides of a bigger space are that there is room to lose parts of activities, and so you want to have sort of enough people on hand who can bring things back if needed. Again, you'll see that we didn't withhold social interaction during those activities because as a part of our teaching, we would interact socially during those activities. However, we would be careful if you saw the next trial to provide non-differential interaction. So she's not like resetting the materials for him real fast with the bowling and not helping to reset materials with the tunnel. It's the same rules across activities. Okay, application number 10, coming back to those clients we were thinking about before. Which of these methods, the picture-based MSWO or the free operant activity-based, is most relevant to the activities you selected in number 9? So could either of those be set up for the clients you were thinking about? A lot of this comes down to your space. Space and whether you can arrange the activities in close proximity to the picture-based assessment setting. And then the follow-up to that is this method going to help you to actually assess some activity preferences for the client you had in mind? And I do see some heads shaking, so I'd love to hear what the other barriers are if anyone's comfortable sharing. Yeah, please. Oh, we need a mic, I'm sorry.
Who was it?
Yep.
Sorry, I wasn't.
Thank you. I snuck a question. I asked for a response at an odd time.
I don't know if this is necessarily where this conversation would go, but what about when you have learners whose preferences aren't necessarily age appropriate? Do you stop assessing those things, or when you ask, when you do your indirect assessment and he likes Elmo and he's 15, you know.
That is, to me, a great example, and way to give me a loaded question. Like, that is not a quick or easy answer. But what I always fall back on is, you know, what the indirect assessment tells us isn't always the whole story, right? Or it might be a story colored by the degree to which a person has had opportunities to contact other kinds of stimuli. So I think if Elmo is our only way to be effective, we use Elmo. But I think it's also our responsibility to try and establish additional preferences that may be less stigmatizing or more developmentally appropriate, if that's part of the goals, you know, for the individual. But I think a lot of times we end up with Elmo is all he likes or Thomas is all he likes because the client has not had an immediate response to some other option, and therefore we did not continue to present other options. So that's, again, where a full-scale assessment every couple of days and integrating one or two relatively new items that you provide a little bit of pre-teaching with is a great way to develop new preferences. It's really, you know, essential to ensuring that we have a range of things to work with, and it's not just Elmo. I mean, very few of us would be satisfied with just one leisure activity the rest of our lives, and I think our clients are the same. They don't have as effective a manner to tell us. But that's a great question. Great question. Any other barriers or comments? Yes, please, Alice. Oh, sorry.
When you're assessing using pictures or verbal questions,
yes,
and you know that the learner, or there's a question whether the learner really understands what that means. Like, if I pick this picture, that doesn't mean I just like the way this picture looks.
Right.
It means actually getting access to the activity.
Right.
So
how do you figure that out?
Yes.
Yep. So that's where two things are critical, especially when you're using picture or verbal preference assessments. One, you need to do more than one trial. So again, 3 arrays for an MSWO. If you're doing a paired stimulus, there's a new write-up that I cited earlier. Bishop and Kenzer talk about just a 4-trial paired stimulus that lets you see the choice, verify the choice, and get to teaching. It's very quick. So you need to do repeated trials to sort of verify. And if you're seeing switching, you know, within a short time period, it's likely that the question is not meaningful. The second piece is that, you know, you get what you choose, and so it's a good idea to actually include a control option if possible. And we're going to elaborate more on that, but it's basically an option that you know is non-preferred. Okay, there's maybe some work associated with it, or it's not in the same class with the other options. And if you see selection of the control, then you really know that question is not meaningful. But by delivering the selected activities or items contingently, we should see differentiation over time, even in people with pretty limited verbal repertoires or pretty limited experience with picture-based systems. If the contingency is there, they will learn in the context of the assessment, but you're probably going to have to do some more trials. Does that? Okay, great. Thank you. So let's get into context preferences and the role of a control condition before we get into how we can actually disseminate these methods. Okay, so preference for teaching context is important. I've alluded to the ethics of asking clients how they prefer to learn when we have multiple effective options. That's the first bullet here. It can also be useful to assess context or treatment preferences of the clients in a direct and objective way when we're not sure if there's added value of an effortful component of a procedure. So there's something that it's sort of best practice to include it, but we don't know if it's going to make a huge difference in efficacy. The main treatment is retained, but we want to see how the client feels about that added component. And then it's useful when the most effective or validated procedure is not preferred by somebody in your decision-making world. That might be a caregiver or a mission statement or an administrator, but sometimes we can use these context preference assessments to teach us not only, you know, from effective options, what will also be preferred by the people who it matters most, you know, the ones who have to experience it. I think these assessments are powerful not just for clients, but for teachers, okay? So when we have multiple effective potential teaching methods, like I showed you earlier with the assessment method of continuous and discontinuous measurement, give teachers a say. If they're both acceptable from a decision-making perspective, they can both work. Let teachers decide how they want to operate in their environment because they're the experts on their environment and what actually is most feasible and most likely to be successful. So I want to give you one more concrete example. And again, this is an example of a concurrent chain assessment, fancy name for a straightforward procedure, where basically, like in the picture-based assessment, there's an initial link and a terminal link. There's an initial link where you're selecting something that represents the outcome, okay, so a picture of an activity. Or it can be, it's important the initial links are sort of non-preferred in and of themselves. If you really want to know about preference among the terminal links, where the intervention is actually delivered. But it can be items actually associated with those terminal links. So let me give you this concrete example. We're doing some toilet training research in my lab. It's another one of those technologies that in the literature is very well developed. Okay, we've been replicated across populations and age groups and lots of procedural variations that we know work well. And yet, when you look at outcomes, a good proportion of people with developmental disabilities do not achieve continence. They do not achieve independence with bathroom routines. And furthermore, the age of toilet training and continence for typically developing children is getting older and older, and it's stressing parents out. This isn't just something we're making an a priori judgment like all kids should be toilet trained by 3. This is something that stresses parents out when they have to deal with, continued accidents, and not to mention, the dignity issues around being an adult with a developmental disability who can't take care of their own hygiene and bathroom needs independently. So we're interested in this, and we wonder how teacher preference affects the use of different procedures in toilet training. So we set up what we thought was this clear choice. We had 2 types of urine alarms. Has anybody used a urine alarm before? Okay, great. So there are different models out there, and they sort of all work a little bit differently in terms of how you affix them to the underpants. And we do have a bit of data suggesting using a urine alarm can actually speed up the training process. It's immediate feedback on the occurrence of the accident. It's also a great prompt for teachers. So I'm making some intuitive decisions that this could be a really nice way to toilet train. It might be helpful to teachers and also effective for students. So we included 2 models of alarm, one that was a clip-on to the underpants and one that was an insert sensor into a mini pad within the underpants. Okay, so 2 different types of models. And also we gave what we thought was a control option. It was a fixed time, 5-minute dry pants checks, i.e. a lot of work. So you can put on a urine alarm and you can go about your daily business, or you can check dry pants every 5 minutes. As a teacher, okay, because we were interested in teacher preferences. I think data on student preferences in this area would also be very powerful, because a lot of people have an immediate, administrators and parents sometimes say, oh, a urine alarm, that's really stigmatizing, that's really, so we could ask students what they prefer in the future. But we were interested in teachers, and so we set up this 2 choices and 1 control that we thought people would avoid. That's what your control condition is, just like my lame plastic fruit I mentioned earlier. There's no reason for them to choose there. Guess what they chose? They totally did. That one. I didn't know the hand was going to do all that. So they decided to check dry pants every 5 minutes. They picked what I thought was the high effort based on intuition option. They did not like this technology. Okay? They didn't like having to fiddle with it. So in this concurrent chain, the initial link was we actually provided a little guidelines for toilet training that had dry pants checks steps on it. That was one initial link they could choose. And then the 2 models of alarm. That was our concurrent chain. So you pick one of these, and then we immediately go and we either deliver the first dry pants check or we attach the alarm to the kid, and it stays in place long enough for an accident to occur. Okay? So we would often do it for half of the day, because typically early in training we saw accidents every hour or 2. So all of the features of the preference assessments we talked about before, I gotta stop that hand. It's like totally, I didn't know it was gonna wiggle. So all the features of the preference assessments we talked about before are here. It's just like the picture-based, right? We've got stimuli that represent the end outcome. We're going to make sure we provide equal duration of access or experience with each one, and that duration is long enough to contact the meaningful properties of the condition. So in this case, an accident or having to implement multiple dry pants checks. And people still picked the dry pants checks. So you need data to figure out which options are best. But this methodology, boy, that shed a lot of light on how we proceeded with our toilet training. These teachers would actually rather check the dry pants. We can do that. So it's good information to have and a real handy assessment method. So some general tips for assessing context preferences. I'm only scratching the surface, but there's a wonderful paper by Greg Hanley in 2010 in Behavior Analysis in Practice that provides lots of additional tips and examples from the literature for figuring out how your teachers want to teach and how your students would like to be taught when selecting among multiple effective options. So you got to make sure that people have a history with each of their conditions before you ask them to choose, and it's best if they have a similar amount of history. So I wouldn't want to take a teacher, you can imagine how this would be different, who had used urinal alarms for several recent toilet training cases and then put them in the choice situation. Their preferences would definitely be, could be affected by their differential experience with each condition. So you want to sort of do this when you're introducing some new treatments. You want to include a control condition, something you think people will respond away from. We were not successful in that with the toileting teacher choice, but in the study I showed you earlier, Carrie Condi's work with the parents using discrete trial instruction with their children with autism, our control condition in that study was to sit and read a JABA article and answer some study questions in a room for 10 minutes with your child with autism and no other play stuff. That's mean, right? I know. But if it's going to be a control, it's got to be lame compared to the items you're interested in assessing for preference. And so we really made it lame. And we only had that one mom who selected it that one time because she thought it was the only way we would let her go home. She's like, well, maybe I have to do this one. But she said, I'm never doing that again. That was one of the, yeah. So control has to help you distinguish between whether somebody is responding indifferently because they don't care. These are two equally preferred options, or they're actually not distinguishing among the conditions. So I'm following some kind of pattern. I do this one, that one, that one, this one, that one, that one. And you will run into that sometimes, and you want to be able to detect it. So that's what the control is for. Okay. And then finally, if you can, hold the same teacher if we're assessing context preferences of children with autism. Just like in the free operant assessment, the same teacher was going to be interacting with the child in both activities. If at all possible, we want to retain, the critical features of the conditions being the only difference. Not make sure that you're not getting more praise or interaction with somebody you have a longer history with in one versus the other. Okay, a couple more tips. It's important to implement the selected condition right away and long enough that the key aspects are experienced. So teachers chose dry pants checks and then they immediately went and did their first dry pants check, and they continued doing dry pants checks for an hour or two until an accident occurred and we gave them another choice. Okay. Limit to one choice per day if you're getting equal selections across the condition. So if you don't have a control yet, especially, and you see that kind of back and forth like the one mom had between continuous and discontinuous data collection, you could consider just providing one choice per day, and that can oftentimes help to eliminate any sort of sequence, if there's some sequence preference or pattern that a person is acting on. Well, I did that one last time, so I'll do this one that next time. You can eliminate that by just giving one choice per day in some cases. Okay, so some take-home points on context preferences. You can enhance the use of your activity and context SPAs by using free operants when space allows. Okay, that was the tunnel and bowling example that you saw. Use picture-based multiple stimulus with contingent access. That's the key when space is limited. And then assess context preferences of teachers and clients when you have more than one effective option. So again, we're not concerned with good data on preference until we know we can be effective. But if there are multiple ways we can be effective, we want to know, based on good data, what our teachers and our clients are most happy doing, based on their expert knowledge of this context in which that has to happen. Okay? So dissemination of these methods. This is a really important point, and it's part of why I'm covering it last, because I hope it will be one of the things you remember when you walk away. Back to that idea of teachers are in the best position. The people doing the assessment and operating in the teaching environment every day are in the best position to decide and to know from data what the needs of the students or the constraints of the setting are. So it's appropriate to disseminate preference assessments more widely, and in fact not just to disseminate one, but to equip teachers with a couple of options so that they can get the job done for every emerging circumstance if possible. And one way to do this efficiently and effectively is through self-instruction. Okay, self-instruction is appropriate for preference assessments in a way that it's maybe not appropriate for some higher risk procedures, and I'll elaborate just a little bit on that. But basically, this is teachers teaching themselves, but teaching themselves in a systematic fashion and where we actually evaluate the effects of that training. So it's different than lecture and hope or read the article and hope that you can use the procedures. It's a level beyond that, but it's still largely self-managed. The teachers do it on their time. They tell you when they're ready to be evaluated, and hopefully you build their repertoires without taking too much time. Okay. So some reasons that preference assessment is appropriate for self-instruction. Even if you get an invalid result, because we're using caregiver input to identify the pool of reinforcers, you're probably not going to do a ton of damage as long as we detect that you got an invalid result, the next time you assess. So because these are done regularly and because most of the items should have at least some reinforcing properties if they're being nominated by caregivers, errors are pretty low risk. We wouldn't want the novice to be doing the assessment every day and getting invalid results, but if we let them try it and they get it wrong, the world doesn't end. Whereas if you reinforce in the wrong manner in an experimental functional analysis, there may be bigger consequences. Pre-teaching choices can also correct the invalid full-scale assessment. So if we have a new teacher try the full-scale SPA, but then we're still going to give a pre-teaching choice multiple times throughout the rest of the day, it's okay if that first one was a little off. The subsequent one should help us to capture potent reinforcers. So I'm not saying don't track whether teachers do preference assessments accurately and with integrity, but in the training process, this is why self-instruction could be okay. It could be okay to teach that less intensive means and assess sort of in situ or in the moment when it's convenient to make sure that the skill is there for the teachers. Okay, so self-instruction can be effective and efficient. Rick Graff, for his dissertation, took a look at this, and the paper is published, and I actually provided in your folders the full self-instruction materials for paired stimulus and MSW assessment. So you've got all of that you're going to walk away with and think about, hopefully, how you might use it. It includes data forms, and again, everything you need. Let's see, the instruction addresses not only running the assessments, but summarizing the results and making decisions based on those results. So now that you've done the assessment, how do you add up and find out what's most preferred, and how do you decide then what to teach with? Okay, so key steps in self-instruction. You want to use the research literature to identify valid assessments matched to your goals. Paired stimulus and MSWO are a couple of great SPAs to have in your tool belt. Develop data forms with descriptive headings. This would be if you wanted to pretty much add to the paired stimulus and MSWO materials, like with the free operant or something else you saw that you like. You want to self-instruct on that. You would follow these steps to develop those materials and evaluate them with good evidence-based practice data, or practice-based evidence data. Okay, here's an example of our data form. And you can see that this is for the paired stimulus. You list your items here, and then each trial is prescribed. So on trial 1, we're presenting item 1 and 2 in the left and right positions. Trial 2, we're presenting items 3 and 4 in the left and right positions, and you can see what the item numbers are right here. So there's a ton of information conveyed in this one data sheet, and in fact, that was an important part of the results of Rick's dissertation, that just by giving people, so if you give them a seminal article to read on a method, they don't know what to do when they go to assessing. But if you give them a seminal article and a great data sheet, they do it almost perfectly. It's pretty cool. Okay, you develop your step-by-step instructions. We called these enhanced written instructions because it wasn't just the article restated. It had some diagrams, which I've actually used a little bit today. It shows you how to physically arrange items, tells you how to manage every possible client response. So if they grab more than one, if they push the items away, if they engage in problem behavior, what is your next response as the assessor? How to score the client selections, and then summarizing and interpreting the results. So this is the whole package, not just how to do the assessment portion. It supplements with instructions, pictures, diagrams. We have segments of the data sheet and then draw lines to where you actually write that down in the form. So interestingly, in Rick's study, I mentioned 4 of 5 participants implementing the paired stimulus with the data form alone actually came very close to having mastery level integrity. And then 3 of 5 with the MSWO, which is pretty cool. Okay, so there's an excerpt from the self-instruction materials you have. Again, you can see it not only tells you what the trial should be, but it shows you. So these instructions are kind of long, and probably most people wouldn't look through them line by line, but they're comprehensive and appropriate to share with, again, variety of practitioners. So that scenario earlier where if you only have 1 hour in your classroom every day, maybe you aren't the person who should be doing the preference assessment. Maybe you should start by doing it, but then you should train somebody who's there to get it done before you arrive, and you can just check their integrity and check the validity of their results, but have less of a stretch on your time. Okay, here's an example again from the self-instruction materials showing exactly how you fill out the paired stimulus data sheet. So you present the trial like this, you circle the one, and then you write the result here, and then it walks you right through how you take that information, score it, interpret it. Very explicit and detailed. Okay, so you allow teachers to review the instructions, and then if you like, you could do a comprehension quiz. So if you don't want people going in, even though it's a low-risk procedure, you don't want them going in to assess before you know they can do it, or before you know they've contacted the instructional materials, you can make them take a quiz and find out, do you have the concepts that the materials conveyed. In Rick's study, we actually gave people only 30 minutes to look at the materials per method, and we skipped the quiz. Okay, and we still got really good results. But if you're very conscientious and careful, you might want to do the quiz step in there as well. And other studies of self-instruction have. Okay, we let our teachers keep their written instructions because there's no reason they wouldn't keep them for reference in the real world. But that may have also contributed to the nice effects that we saw. Okay, so if a teacher passes the quiz, then you have them actually go and assess client preferences. And you're going to want to observe or videotape that assessment so that you can score integrity and determine if they've contacted all the relevant possible client responses. So, if they have a client who's real compliant and they don't actually grab multiple items, you're going to need to assess again under those conditions and make sure they can do it. But this is sort of the evaluation of the self-instruction training. And then finally, you're going to proceed to your typical integrity monitoring. So you're still checking in every now and again to make sure the assessments are going well, and you're reassessing for reliability. But you've disseminated this tactic now to others who can help you get better data and more data into your decisions. Okay, so quick recap. Review written materials, pass a comprehension test if you like, complete a natural test, score it from video or score it live as the trainer. Assess generality if you need to, if the teacher doesn't contact all the relevant student responses. And then finally, teachers complete direct training if they don't do well on those natural tests. So you might bring them back for some modeling or some more role play rehearsal and feedback, or traditional but more time-consuming training methods. Okay? So mastery criteria, real quickly, these are going to be familiar to you. It's important that teachers can implement all the steps, that they respond to the full array of behaviors a student might emit, and that they can actually use the data they collect. This is the piece that's been overlooked in some prior preference assessment training literature. The idea is that they do the assessment so they know what the reinforcers are, so they can use those reinforcers. We want to make sure we fill in that final step and really equip our teachers to be decision makers along with us on the basis of good data. So just some of the data I alluded to from Rick's study, you can see that here it was just the JABA article, and they got some of the procedures right for an MSWO. A little bit of a level change with the data form and the JABA article. With enhanced instructions, we got perfect integrity, which was maintained when we introduced a student in the natural probe at the end. And very similar findings for our paired stimulus, except an even bigger jump. They knew less after reading the article on paired stimulus and more after seeing the data sheet, which makes sense based on the materials. Okay, so some quick take-home points here. We're getting close to wrapping up. We need to equip teachers with a range of preference assessment strategies. We can do that by using really time-efficient and flexible training methods for those assessment variations that we think are best matched to the needs of the students in their environment. So again, it's not a one-size-fits-all. Your goal can be over time to equip teachers, the people you're supervising who actually deliver assessment and maybe have more time to deliver assessment than you as the specialist. You're equipping them with a repertoire that they can then match to emerging circumstances. And then finally, you want to provide direct training and feedback for that subset of teachers or cases as needed. So I do have just a closing comment, but I wonder if I should tackle the questions first. I haven't noticed how many have rolled in.
I think 3.
Okay.
It's just one of them's really long.
Yeah, I don't know. Have you read it? Can you give me a synopsis?
It had to do with the Elmo question.
Okay.
So it's almost more of a suggestion.
Okay. Is there a synopsis or not really? Not really.
Okay.
All All right, I feel badly, but if I have a time, I guess maybe I'll come back to that because it's a lot to take in right now. Okay, so if you were to set up preference assessments for community outings, social activities, or vocational choice, how would you set up the contingency or reinforcement after the choice if you're using pictures? So great, that gets back to that issue of a delay. And we don't have good answers for this yet, but some areas that have been recommended is to, try and provide some kind of mediating consequence. So if your choice is between Arby's and McDonald's, and we have those pictures, and we're like in the van, we're ready to go, and you choose Arby's, and then I switch the position of the pictures and you choose Arby's again. So it wasn't just that it was a left choice and not a right choice. We immediately start the van, and maybe you hold the picture of Arby's, and we drive to Arby's right away. And the hope is that even though you can't get to Arby's for a few minutes, that seeing the route being toward Arby's rather than McDonald's, holding the picture that is Arby's rather than McDonald's, will sort of mediate and provide some conditioned reinforcers for that choice specific to that outcome. But ultimately, we have not tested this to know if it's enough. And probably the answer is it depends. It depends a lot on the learner's history. So not real easy answers. There is some new research out there, one of which I cited, on computer-based preference assessments. So the mediator is basically, they make the choice and then they see the place that they're going to be going and see that video, and then they can be there soon after. But no easy answers. You got to get creative and, repeat your assessment so you know if you're getting a valid outcome or not. Okay? Good.
Janet thinks she can summarize that.
Oh, great.
Yeah.
Okay.
So the comment online from someone that we were talking about that was longer, I'm going to try and summarize it. They were saying they work with a 17-year-old who has a very similar issue to the Elmo, but this person's preference is just Sesame Street, I think, in general. And what this person was suggesting, that what they do is they allow that reinforcer in the home environment, because that's a more appropriate place for that. But then when they go out in the community, they're trying to develop more socially appropriate reinforcers.
That's great.
Age appropriate.
Yeah, don't settle for a restricted set of reinforcers, because in all probability it's been a restricted history with different items. So you can build that up, and I think that's a great recommendation. Okay, did I miss one here? Oh,
One right before it about tokens and points.
yeah. I'm not really sure how to answer that one. Preference, because really the preference assessment so the question is sort of like, and I might be misinterpreting, like, can you assess token preferences, but you'd be assessing the activities that you were exchanging the tokens for. So I really don't know what else to make of that. But yes, tokens are conditioned reinforcers, not the actual reinforcers.
Yeah, I think that's all the question was.
Okay.
There's actually a new one.
Okay. Are there any here in the room that people are dying to get out? No? Yeah, Ben? And then I'm going to look at this one while I listen to Ben.
Perfect.
Easy question. So you talked earlier about some group stuff that you had done with preschoolers. Any chance you've done group stuff with adults? Group preference assessments with adults.
Group preference assessments with adults have not been conducted that I'm aware of. I haven't done a full lit search recently, but the methods used with the preschoolers could very easily be adapted to like a supported work setting or a leisure area in a residential facility.
I'm just thinking about making a trip to the mall and setting up at the food court and seeing where they all go.
I love your creativity. If you have the staff to do that safely, I'd go for it. So there was a good question online about for crafts. So if craft activities are a student's preference, it takes a long time to do a craft and to assess that in a preference activity. So definitely point taken. I think that some creative things people have done in the past is you sort of get a craft that has been done previously, but you maybe take the last step off, and that's what the person chooses to do. They choose to sort of complete the craft rather than do the whole thing. Or maybe they choose to, as much as you can get the activity ready or disrupt it partway through. It's okay to give a choice between, do you want to finish painting this painting, or do you want to start watching this video? But yeah, definitely it's okay to limit the amount of the activity for assessment purposes that you allow. Same goes with food. If like yogurt or soda are potentially preferred, you want to just provide like a swallow or a bite of yogurt on a spoon as opposed to the whole container, because then you're taking something away that's valuable. You're setting yourself up maybe for some problem behavior. Okay, I have a quick closing comment. Is there any other question in the room here? Okay. So the last thing I wanted to say, I have to confess again, actually. It's kind of embarrassing, lots of confessions, telling you I'm not the teacher I need to be without good data, which is absolutely true. My other confession, bringing it back to Noah, and this is actually when he was 9 months old in the midst of a largely unsuccessful sleep training effort on my part. Why? Because I was operating like a mom and not like a behavior analyst with data, and I'm okay saying that, that in the absence of data, my treatment integrity stinks. I reinforce the problem behavior, all of those things, even though I know better. The good news is I also know how to fix it if I do create a problem. But I bring Noah up because we've only scratched the surface, and the truth of the matter is that only the clients you're serving, only the people you work with every day can teach you the rest of what you need to know. But you need to take the time to capture and to interpret and to understand what they teach you through their unique and revealing behavior. Okay, so this is hard work to be data-driven. But I think it's worth it. I think you have the expertise and the tools from your training. I think you have the compassion and the patience, or you wouldn't be in this field doing the hard work that you're doing. And I think that you want to learn the story of your clients and your supervisees, okay? And to learn that in the most true way you can, which is through their unique and revealing behavior. So I hope that you won't miss the opportunity to include them in your decisions and to pass on the legacy, okay, of Skinner and Lindsley and Bailey and Wolf and so many I can't even name on the spot, but who taught us that what we have to share with the next generation of practitioners and what we have to help society is not a bag of tricks, and it's not a recipe style, one-size-fits-all, what to do. Okay? It's why we do it. It's our science, our values, and our data. Okay. Thank you so much.